Children with limbs hacked off, machete wounds intended to kill, and waves of seriously wounded casualties arriving almost daily. The MSF teams working in the Central African Republic are witnessing unprecedented violence.
The extent and level of the violence with these types of wounds makes it very difficult for the teams to cope. I'm not talking about 1 or 2 cases a day, but several, and depending on the period, as many as 10 in one day. It's not unusual to see people being pulled out of taxis, or as they walk along the road, they get taken for a Christian or a Muslim and are attacked or even lynched.
The extent of the violence has caused Christians and Muslims alike to abandon their homes and leave everything behind them. Some are crammed into overcrowded camps, like this one near Bangui Airport. Others have taken refuge in the bush, or are already on their way or waiting to get to Chad or Cameroon. No longer limited to Bangui, the fighting is spreading. The northwest of the country is particularly badly affected by the violence.
Since the Seleka rebels have disbanded, many have been fleeing the country and during their flight continue to attack the Christian population. But now there are also more anti-Balaka fighters and they are targeting the Muslim population. Along lots of roads we are seeing villages that have been completely deserted and torched.
MSF teams are running 14 projects in the Central African Republic. Insecurity often makes their work more difficult, notably around healthcare facilities, but it is vital to a country racked by lawlessness, violence and looting. Tens of thousands of displaced people fleeing the fighting raging throughout much of South Sudan have sought refuge in the capital, Juba. MSF teams are working in Tomping camp, which is on the verge of a full-blown humanitarian disaster. Data collected by doctors indicates that the mortality rate, particularly for children under 5, now exceeds the emergency threshold.
People have been staying in the camp for more than 5 weeks and we're still not seeing any sign of people going home. They're living in extremely difficult conditions, water and sanitation extremely poor, not enough space, only around 10 square meters per person, which our normal standard would be 16 square meters per person in a camp. The main diseases we're seeing in the Tomping camp are malaria, diarrheal diseases and respiratory tract infections.
The fighting in South Sudan complicates the team's work even more. In Lear, where MSF has been providing assistance for 25 years, a team was forced to flee into the bush with their most critically ill patients. They continue to provide medical care there, while in the town, government forces clash with rebels. This is Zaipi camp in Uganda. It was designed to accommodate 3,000 people, but when the refugees started pouring in back in December, there were up to 20,000 people here.
When we arrived on the 7th of January in Zaipi, in Adjumani district, the situation was very chaotic and we have put in place immediately water tanks to provide water. And we have also put in place an outpatient consultation which was addressing the urgent needs of the population.
The number of people arriving has now dropped, a relative lull that the humanitarian aid effort uses to get better organised.
In the health center where we are involved, we scaled up the capacity for the inpatient department. So basically we increased the capacity in the delivery room and in the maternity. We have implemented intensive feeding program for the malnourished children and we have provided staff.
Because of the overcrowding, these refugees are waiting to go to other camps, but they too will soon be over capacity. Originally from Juba, Awariel and Bor, these South Sudanese people have been forced out of their towns by intercommunal violence. Neighbouring Kenya also hosts many refugees. Every day sees hundreds of new arrivals. When they get here, they are very weak, having travelled on foot in the roaring heat. As in Uganda, the MSF teams are concerned about epidemics and have started to vaccinate children against measles and polio. The maternity unit in Khost first opened to patients in March 2012. Gynecologist Séverine was there right from the beginning.
Unfortunately, there was a major security incident in April 2012. A bomb exploded in one of the toilets of the hospital, and unfortunately 7 patients were hurt. And MSF closed the hospital and the project for 8 months in total. And before MSF decided it was safe to come back, there were many community negotiations and meetings and difficult decisions.
The support of the local community helped to make it happen. They were convinced of its usefulness right from the start. And a year ago, the unit reopened.
We were going to open on the 30th of December, and then on the 29th of December, someone stood in front of our gate about to deliver, so we really couldn't send her away. So we let her in and we delivered a healthy boy. So the first boy was already born before the hospital was even open, which shows again the need.
30 to 40 babies are delivered here every day. Their mothers have confidence in the doctors. And what better way to attest to the support of the community and ensure the sustainability of the maternity unit? 1 year on, the team now hopes to provide care to women in remote mountain villages who have no access to medical services.